Hello everybody, I am Dr. Neil Grossman. I'm an interventional radiologist at Metro West Medical Center, and I'm very pleased today to be describing a procedure that we are offering called balloon kyphoplasty. Balloon kyphoplasty is a procedure that is used to treat patients who have vertebral body compression fractures, and these are usually related to osteoporosis. These fractures can be incapacitating. We are thrilled to be offering this procedure at Metro West, so let's now take a look. Today we will be performing a kyphoplasty procedure. Kyphoplasty procedure is a procedure that is performed for treatment of patients with back pain related to either a subacute or acute compression fracture. These fractures are typically occur as a result of osteoporosis, but the treatment can be performed on patients who present with malignancy or traumatic fractures. Today's case is a 68-year-old female who presented to the emergency room with severe back pain following a fall. Initially in this patient, plain films were obtained, and I evaluated the patient. The patient's back was percussed, eliciting an area of maximal discomfort, and this level was marked. And you can see that this is a lateral view of the lumbar spine. These are the normal appearing lumbar bodies, which are either rectangular or square in shape. There's an inferior end plate, which is the bottom of the body, and the superior end plate, and these typically are very sharp linear configurations. In this patient, this is the T12 body, which corresponds to where the pain was, and this is markedly compressed with a dipping deformity of the superior end plate and a similar deformity of the inferior end plate. This confirms the presence of a compression fracture.
I was at home and I had a slippery floor in my shower, which I wasn't aware of, I guess, and slipped and fell in the shower and had a very difficult time getting out of the shower and a more difficult time trying to get up. Finally managed to be able to get to a phone and someone brought me to the hospital. I met with Dr. Grossman. He explained the procedure and it sounded like it would get me on my feet a whole lot faster, so I'm willing to undergo this procedure in anticipation of getting my life back on track.
Now placing the first cannula in. And through this we can see our approach in terms of make sure the angle of the trajectory of the cannula is appropriate for entering the proper area of the body. Okay, so now we can go back to the AP, please. We're now going to advance further into the vertebral body. The angle looks terrific for placement of the balloons and curetting and all that. Okay, let's go AP. On the lateral view, this looks terrific positioning. And in the AP view, it looks terrific. We're now going to go to the other side. Okay.
A small machine. You know what I mean?
We're now ready to put the balloons in. And I think we're also ready to start mixing the cement. Balloons being placed now through the cannula. You can see those two metallic dots which are identifying where the balloon is placed. And start inflating it now. The other blue is now going in on the other side. Inflate. This balloon's harder to see because it's partially obscured by the balloon on the other side. You can see it now filling along its superior and posterior margin. It's now coming close to the inferior, close to the superior end plate. Yeah, I think you can see on this last ladder we just took, which the superior end plate is now migrated superior, which is one of the things we want to achieve by this. Two things we want to achieve. One is alleviation of the pain. If you can restore the height of the body, then the biomechanics will be significantly improved. And then on the AP view, you can see these two kissing balloons, really well situated. Now I'm going to put the bone filler in. Now putting the bone filler on the other side. And you can see the bone that the cement is well positioned in the center of the body. And it's really fairly symmetric. It's covering both sides equally. So there's very good filling of the vertebral body just along the undersurface of the superior end plate, which is where the major component of the fracture is. And now that's well supported. So I think we're all set. Let's go just take a look at the lateral view for final film. And again, the lateral view, there's very good filling centrally as well as supporting the undersurface of the superior end plate. Okay. Thank you, everybody. We're all set. The patient is now being prepared to be brought down to the recovery room to wake up from her anesthesia. Just one final look at the films. Again, we see extremely good filling of the central core of the vertebral body and protection along the undersurface of the superior end plate, which is where the major fracture was, supporting it and hopefully protecting from any further fracture. This is a very good radiographic result, but the most important result of this is how the patient feels. And when she wakes up, we will visit her and hopefully find that she is improved.
Well, it's been 4 weeks since my surgery, actually 4 weeks today. And it's one of the best things that I ever decided to do. As you can see, I'm able to be up and do activities of daily living. There is no pain and no residual from this. I was able to come home the next day from the hospital and with help do what I needed to do. And I am just so grateful that my Dr. Lee in Framingham recommended me to talk to Dr. Grossman about this surgery. This surgery really is a miracle surgery as far as I'm concerned. I'm too busy and too active to be laying around in bed for 3 months. Framingham Union Hospital was a great place to go. Everyone was terrific there. And if you're thinking about it, don't think too long.
Well, I'm thrilled with the results that Mrs. Powers had from doing the kyphoplasty. She's pain-free. In the video you saw that she was able to get back to her activities of daily living. And this is a typical response. And this is what makes this a very satisfying procedure for me to do. We appreciate your watching. Thank you very much.